I'm Dr. Igor Simonov, and today I will continue explanation how we use Tsun Ko position as explained in difficulty 1 of Nanjing, and the Qi Tsun position for the pulse diagnosis and treatment of patient using the rule and the phenomena which explains that our Qi moves from the yin to yang every 28.8 minutes. So it's very good key which practitioner should use, and because it is very helpful, and practitioner permanently should check his Tsun Ko position on his wrist to see when actually Qi moves from yin towards yang and from yang towards yin, as it explained in the difficulty 1 of Nanjing. So here we can see the patient female patient who came to the clinic with a sensation of pain in her urinary bladder. And what we can see here, that actually here is some deficiency in large intestine, excess in small intestine, deficiency in stomach meridian, and excess in gallbladder meridian. In reality, nothing happened in the urinary bladder meridian and nothing happened in the kidney meridian, where the patient has, for some reason, the symptoms. What we can see here, that actually here is some pathological movements of the Qi which happen, for example, from kidney to small intestine and go to the lung, which something happened in small intestine. Also from heart to large intestine, go straight away to the liver, and from liver go to the stomach meridian. So we can see here which more affected is the small intestine, large intestine, and the liver meridian. And if we will look how we treat, how the different zones of our wrist, they reflect condition of patient. So we can use difficulty 18 of Nanjing, even better the third chapter of my Ying, the book of pulse diagnosis, which explains that also together like the Nanjing, that upper part Tsun is the upper part of the body, middle part Guan is the middle part of the body, and the Qi is the lower part of the body. So what we can see here, that actually with our patient is only where we take the pulses, is only here large small intestine affected, which is Tsun, and we'll say stomach and gallbladder, which is Guan position. Nothing happened actually in Qi position. So it's very important in the 18th difficulty of Nanjing, and the My Jing explains that yin is born in the yang part, and it appears in the yin, in Qi, and yang is born in the yin. Yang is born in the yin part, in Qi, and it appears in Tsun. So actually through all these three positions, the Qi moves upwards and downwards. So in our case, the which patient has the symptoms of something wrong with the lower part, in reality it's due to the something is going wrong in the upper part and can't go down because middle part is affected. The same even nothing is affected in the lower part, you just can't go and exchange with the upper part. So what treatment was done? We choose just this triangle of the large intestine, liver, and the stomach. So here we can see large intestine, liver, and stomach. It's where the two organs exactly affected, and two of them they actually in the middle part of the guan. So of course what we use is large intestine is the movement of the fire point, liver is the wood, so wood point of the liver, and stomach also is the wood point because it's the wood movement in this moment. But patient, we started the treatment checking the Tsunko. It was yang time, so energy was increasing in the yang part before it going to the yin part, yin time moving down. So it taking some 28 minutes, and what we use together with these points, we need to prepare this energy because affected the middle part, energy can't exchange. We use it the point low of large intestine to help move to the liver, point low of gallbladder, and here point low also of the stomach. So when moment come, and we could see through my own pulse in Tsunko that actually it changed from the yang to the yin part, which is very important for this our treatment, is the movement from one to another one. So what happened? We removed needles from the low of the stomach, low of gallbladder, and low of stomach, and low of a large intestine, and put it, because now energy was start to increase in the lower part, be ready to go upwards, and put the needles on the low of the lung, low of liver, and low of now is the pancreas, spleen, and left the points large intestine, fire, liver, wood, and the stomach, wood as it was. So what happened? That we actually allowed that chi increase in the upper part, and in the moment when its Tsunko shows its change, we changed together with this moment the needle in the low meridian, helping go down, and after that helping go up. So straight away patient actually start to feel some sensation in the lower back, and the symptoms of some pain in the urinary bladder decrease very quickly in the same moment of the treatment. So next time when the patient came, he was nothing actually was wrong in the upper part, and I would say that when the patient came with some urinary bladder affection, patient had also, she had some skin eruption on the face, so actually help us to see that it's actually something is wrong between upper and the lower part. So second time when the patient came, there was nothing wrong with the upper part. So what we can see, it is nothing with the large intestine, nothing with the small intestine. It's only some disbalance between the stomach and gallbladder, so middle part. So what treatment we did? Of course the patient had much less pain in the urinary bladder, no more eruption on the face. So I use it again, the stomach meridian now is the wood point, and the gallbladder is the earth movement, so earth point. And when we start the yang time, so I left the low meridian of the stomach and low meridian of gallbladder when the qi was increasing in the upper part, and when the Tsun-Ko showed that the change happened, low where changed from the gallbladder to the low of the liver, and from the stomach to the low of the pancreas. So qi start to increase and move, ready to move upwards. So very quickly, of course, say in the couple 3 treatments, all symptoms he disappeared. So actually what we can see is that in the second treatment nothing is anymore in the upper part. It's still a little bit symptoms in the lower part of the body, but very quickly this condition was relieved, symptoms has disappeared. So in this case we can treat different kind of diseases, like the symptoms of the skin condition, maybe lower back, varicose veins, problem with hair loss, and so on, because just everything we need to see, we need to follow this exchange between the Tsun and Qi through Guan. And how we can find it? We can find it in the moment, exactly moment, through the Tsun-Ko. Thank you.